Hello, everybody. I am Dr. Raktim and I'm here to discuss on the topic of social marketing. Social marketing, you may think, how come it comes under community medicine? But often, social marketing is very important to launch a product, be it tangible or intangible. So, in healthcare, the social marketing helps in launching a product. Let us begin with the topic. Coming to the introduction part, social marketing is a process of motivating people. So basically, it helps in motivating people to voluntarily adopt a particular behavior which is beneficial to them. Hence, the healthcare providers who gives the message of behavioral change communication, what they are doing, they are using the principles of social marketing to adapt the community that a clear and recommended behavior is adopted by them so that the whole community gets benefited. That is social marketing. These principles and techniques will assist to gain the acceptance, willingness of the community to adopt a particular behavior. The Indian cinemas also have targeted social marketing in a very good way. The movies like Toilet, Ek Prem Katha, The Padman focus on social marketing and the social issues of the public for a better behavior change communication. Let us now come to the point of objective of social marketing. It is a basic core of public health. It helps in promoting the public health. It improves health for all and it relies on preventive medicine. Coming to the principles and techniques, basically there are four P's regarding social marketing. We would be discussing one by one. The first one is the product. The product for the social marketing, it may be tangible or intangible. When we say tangible material, with this I mean these are the products that are distributed to the community or the target audience for so that they adopt a particular behavior. The desired behavior is adopted by that target population. A small example in this regard I may cite is the condom promotion by the government for the female sex workers, for the men having sex with men, or the transgenders and their clients. So, that is one kind of tangible material which is used by the government for social marketing, that is, condom promotion. Now, when we say intangible services, it uh, the non intangible services are the non physical experience based services that provide knowledge, support, and psychological benefit to the target audience. It cannot be seen as such. So, few of the examples of intangible services are the free health checkups that is being provided, uh, nutritional counseling and support, smoking cessation centers where they provide counseling regarding the cessation of smoking and other harmful tobacco products. Even in day to day life, the intangible services that we provide are the career counseling or mentorship programs. So, such are those intangible services that is being offered for the behavior change and communication of the target audience. But one thing we have to keep in mind is regarding the tangible material or the services, how is it branded? The branding is very important. In case of tangible materials, the packaging is very important. Both for tangible and intangible services, the positioning and the product development are important. Because if these issues are not uh, taken care of, then it creates a problem at the later stage. Here I want to cite an example that suppose the condom promotion. When the condom packets are not packaged properly, it creates a taboo among the users. If it is not positioned properly, just like if it is, if the target audience has a taboo or it creates a stigma in its use, then that product is unlikely to be adopted by the target audience. So proper positioning is very important. And keeping all this in mind, the product development is taken care of. So for that, the pre-testing and obtaining feedback by the target audience is very important as it reduces the obstacles in social marketing. So before developing a product or before launching a product, proper homework of pre-testing, obtaining feedback regarding its development, branding, packaging, positioning, and distribution. All these things should be taken care of. And it should be by the target audience. They will give you proper advice and solutions of how to initiate it. Second principle comes the place. Just like I said, it is very important for the success of social marketing. The users are most likely to find them without any stigma. That place is most preferred. If the users have a stigma to buy anything or to use a product because of the some issue with the place, then that product is likely to be avoided by the target audience. So choice of place is very important. Otherwise, it leads to poor utilization, leading to the failure of the program. The first thing was the product, second is the place, third comes the price. It is very important for preventive or promotive health that when the demand is more, only when the price is low and the personal income is very high. The perceived value of health services determines the demand. We have to generate the importance of the product or the service among the target audience in a very reasonable price, at a price that is affordable by the target audience, acceptable to them, so that it is being used. Here I want to cite one example like the price of Mala N and Mala D. One is fine, one is found free of cost and the other one is chargeable. Why so? Because if it is being provided free of cost, then the target audience are likely to avoid it, thinking that it is not worth it or not up to the mark or the standards. So the product is then likely to be avoided by the target audience. So if you keep a price for that, then the mindset becomes that the product is useful and the target audience are likely to adopt the product and thus leading to their behavior change communication. However, how much price to keep is also an issue. It should be again decided by the thorough homework of pre-testing and getting feedback by the community and target audience. When talking about price, there are two terms which often comes here. One is known as convenience cost and the other is response cost. When we say about convenience cost, it comes from the person who is launching the product. That person will decide how much time, energy, and physical effort a person must expand to access the social marketing strategy. And when we say about response cost, it represents the personal risk discomfort, and the sacrifice that a person perform for the desired action from the consumer point of view. I will try to cite few examples. When we say about convenience cost, so we will think about when a new person has come to a new place, then how much time that person will devote in learning the new pathways of public transport and all. So that energy, time, and psychological stress that a person may incur in learning all those new routes. So that cost is known as convenience cost, and it is decided by the provider's side. And in response cost, the same thing. It is from the user's point of view that suppose a person who was a smoker before and he is now in a peer group, the social awkwardness that he faces when in his peer group, and when he says no when his friend offers a cigarette to him, so that cost or the psychological discomfort or sacrifice that he incurs is known as the response cost. So both these costs are intangible, it is personalized, individualized, and difficult to quantify accurately. Still, before launching a product or a service, these things are to be kept in mind. Next is promotion. How we promote a product or the service is very important. The constant visibility or the high visibility, it reminds the existence of the product or the service to the user. Again, timing is very important. Time to launch a product is very important. We have to seek the time when the user is most likely to accept the idea, product, or service. That in that time, in that particular time, that new message should be launched for the target audience. And that message should be coming from a authenticate source and a form which is most acceptable. Otherwise, that message will be ignored by the target audience at large. Here, I want to cite a small example that at the time of COVID 19, keeping distance of two hand distance from one place, from one person to other, use of masks, promoting hand hygiene, these are done by Sri Amitabh Bachchan for the community. And that was at a time when COVID-19 pandemic was happening. So that message of hygiene promotion measures at that suitable time by a authenticate source of like Amitabh Bachchan and in a form that is acceptable to the community was a key uh, technique or the principle applied for social marketing. With this, everybody knows that India was able to um, effectively um, hold the COVID 19 pandemic. So, the message should be designed in such a way that it is acceptable to the community. It should be coming from the authenticate source and in a form which is most acceptable for all. So, when all these three happens, then the promotion of a certain product, service, or any uh, idea becomes successful. These were primarily the four P's of principles and techniques of social marketing. Coming to the design of a message now. How to design a message? Like I said in the previous slide, it depends upon the local sensitiveness. Our message should not harm the cultural beliefs of others. It should be sensitive to the local feelings and issues of the public. It should be designed in such a way that it should target the particular group, and it should educate them about the existence of the health problem. Number one, it should empower the target group to undertake certain action or behavior recommended so that the behavior change communication takes place in that target population. And also, the message should overcome any social, cultural, and traditional practice that resists change. Unless these three uh, points are being taken care of in designing a message, it will not be a success. Our message should be such that it should be clear, concise, and appropriate culturally, locally, and it should hit hard to the community so that it undertake the action, behavior, recommended change happen. Coming to the next slide now. Here in this case, we will be discussing shortly about the stepwise approach. Number one, see, we have to identify the social problem. On what product or service we have to develop? We have to identify a social problem. The establishing the methods of social marketing here. So for that, we need an in-depth identification of health problem. We have to know about the customs, beliefs of the community. A consensus building should be made through operational and political cooperation with the community so that when the product or the service is launched, it is accepted. Unless the step one is successful, we cannot proceed with further steps of social marketing. So when our step one becomes successful, we will go to the step number two. Here we have to identify the priorities from the target audience. Okay? We have to implement our efforts in mitigating them. Uh, all the problems that are listed by the community, we have to note it down, and then we have to think about the priority problems among them. So when we prioritize, we will save our resources. Otherwise, if we want to target every problem, it will be a waste because we will not have such time, energy, and money to target all such problems by the told by the community. So we have to prioritize the problems and that such that our resources are managed effectively. The health problem and the objectives must be assessed carefully and from the consumer point of view. In this case, cost analysis and cost benefit analysis is done in advance. After this step two, we come to step three. We have to analyze our marketing strategies, how we will proceed with that, and how we have to develop the social message. Unless we develop a clear, concise, and appropriate social message, it will not be accepted by the community and the target audience. So, the analysis of the marketing strategies and activities are important. In this case, the continuous evaluation of the message is important. And it should also accordingly change from time to time when the desired outcome is fulfilled. Here, in case, one example I have cited is that a message for HIV prevention for college students will be different from that of female sex workers, truck drivers, and housewives. A single message of HIV prevention will not work for all the four categories. Okay? It should always be different for the college student, for the female sex workers, for the truck drivers, and the housewives. So in this case, four different social messages should be put for HIV prevention. We cannot rely on one message. Thus, the marketing activities should be analyzed properly and social messages should be developed appropriately, targeting the target audience. After the step 3, next comes the step 4, while we will target the audience. In this case, market segmentation is very important. Just I said that a social message of HIV prevention, a single message will not work for all the four group of people. So we have to know how to identify those four groups. We have to know how to identify the groups upon which our social message will be based. That is known as market segmentation. It will result in better and effective social marketing strategies, ultimately leading to success. After the step 4 comes the step 5, where we will identify the attitudes and potential resistance and the barriers that will come up from the target audience. In this case, the attitude testing strategies are applied before launching the product or the services. The attitude testing strategies are applied so that how to frame a social message, how to deliver it to them can be logically put. It also depends upon the customs and values of the target audience. Again, while our field survey is going on in this regard, the same consensus building with the target audience is very much important to overcome the resistance. Otherwise, again, if it is not done properly, it will lead to a failure. After step 5, next comes the step 6. We have to identify the objectives for each group. We have to particularly note down the expected outcome or the change what we are looking for. The proposed behavior change must be documented and quantified. The effect of each message should be assessed periodically. It is not like we have developed a social message, we are broadcasting it or giving it to the community and then we are forgetting it. We have to continuously evaluate it, whether that message is working effectively for us, whether that message is uh, leading to a proposed behavior change that is being documented or not. And if somehow that message is fulfilling our need, then we have to also plan so that a change of the social message is done from time to time to reach to a larger audience. After these basic workouts, we develop a social message. We have to select a marketing and the distribution system, how our message is uh, distributed to a larger audience, and finally, to check the impact of the social message, we have to keep on evaluating it. These are primarily the 9 steps for social marketing strategy. It caters to all the 4 principles of social marketing. So, at last, I want to say that awareness generation among the users or the target audience is very much important. We have to consider the cultural beliefs, customs of the target audience in designing a social message so that a proper desired behavior change is documented. After designing the social message, we have to decide when and how to launch. We have to think of the correct timing of launching it, how we will broadcast it, because the government systems do not have a good branding. So, how to launch and how it will reach to a broader audience, we have to decide. And finally, we have to take up call whether that social message is providing its impact or not. We have to continuously evaluate it. We have to talk to the community. We have to talk to the target audience. and discuss among the peer group whether any change is required from time to time, it will lead to a success in social marketing strategies. Coming to the limitations now, the accurate market analysis is mostly not possible because the social marketing strategies are taken up in a segmented manner. So, market analysis is very difficult task. Secondly, the market segmentation itself is detrimental to the effort because it creates a segment, it creates a groupings that okay, this kind of people will have such and such social message, and the other group will have such and such social message. So it creates discrimination. So it may be detrimental to the efforts. Thirdly, developing a product strategy is itself a difficult thing. How to develop a product? Next comes what is the price that will keep in launching a product? That is a challenge for all. The pricing strategy. Just like I said, that if you distribute free condoms or if you distribute free contraceptives, then the person or the target audience are unlikely to use it, thinking it to be of low quality. And if you keep a price that is very high, it is unaffordable to the society or the community at large, then again that will not be accepted. So pricing strategy is a challenge itself. And then after launching it, we have to select the channels of dissemination, the message, and the communication options. It is limited. It is limited. Funding is very low, and with all such limitations, the social marketing strategies becomes a challenge. And lastly, many of the health planners lack the knowledge of marketing strategies and principles. It has now come up in the medical education, but still, the health planners lack the marketing principles and techniques if you compare it with a marketing person. So, with this limited knowledge, it becomes again a limitation for the social marketing strategies to be successful. So, these were some of the limitations to highlight it. That was all for today's lecture. Thank you very much. The social marketing strategies for the undergraduate level, it comes as a short note, and for the postgraduate level, it often comes as a long question, combining it with some of the national health program.